Hi everybody, let's talk about preventing injuries with proper lifting and with back safety. Back safety and proper lifting can prevent a number of different types of injuries. Back injuries, shoulder injuries, neck injuries, all kind of sprains, strains, bulging discs, sometimes ruptured discs, things of that nature. But if you've ever had a real back injury, then you probably understand what I'm about to talk about, because a lot of times when you have a lower back injury, maybe it's a disc or a pull muscle or something along that line, it is very difficult to find a comfortable position for a very long time. Every few minutes it seems like you have to find a new position to stay comfortable. Now they can give you the painkillers and maybe even some of the other medications that they use to treat these type injuries, but standing, sitting, laying down, sitting down for long periods of time, it's just not, it just seems like you have to use a combination of stuff to try to find some relief from the pain from some kind of back injury or something along that line. But it is a lot easier to prevent than it is to repair. So let's focus on preventing injuries by using proper techniques, proper lifting, and we'll go through and just see what to talk about. See, the screen here says that the force is against you. And this will make a little more sense. It's not like Star Wars or anything, but this is kind of like, you know, gravity is always on, gravity always works type stuff. So when we talk about that, we look at different methods of how lifting can affect your back, especially your lower back around your waist and so forth. So I like to look at this. This is kind of like a seesaw. I call this a fulcrum. And it shows the amount of force that's placed on your back by lifting, and that amount of force may surprise you when you take a look at it. So think of your back as a lever. The fulcrum is the guy in the middle. If you put 10 pounds on one end, you put 10 pounds on the other end, it should balance out. So basically it takes 10 pounds to lift 10 pounds. But if you move that fulcrum over to one side over here, it makes a huge difference, because this same 10 pounds now takes 100 pounds of pressure to lift it. Now, when we think about this, a lot of times when we shovel, and we learned this a lot of times in shoveling, because we'll take the shovel, we'll get it into the gravel or the sand or whatever it is, all the weight is out on the end of that shovel, and we're turning at the waist. But keeping in mind that shovel is out here, that fulcrum has moved to away from where the weight is, and it makes it very difficult, and it adds a lot more weight from the 10 pounds that it would normally take to now 100 pounds to lift that. Now, if you add in a 105-pound human torso, which is from the waist up, you would see that lifting 10 pounds of objects would actually put 1,150 pounds of pressure on your back. Now, here's another issue here, because if you're a little like me and you got a little more in the front than the average human torso, if you were 25 pounds overweight, it would add an additional 250 pounds of pressure on your back every time you bend over. So to pick up that 10 pounds, now it went from 1,100 pounds of pressure on your back up to 1,400 pounds of pressure on your back. So gravity is pulling against you once you bend down. This extra weight is pulling against you on your back there. So there are a number of things that we have to do to make sure. Now, going back to this slide right here, number one, what's he doing wrong? You can look at this and see he's obviously not bending his knees. He's bending at the waist. He's trying to lift with his back. Because when you pick that weight up right here and your back bows, you make that bow and you make that noise, you know, there's a noise you're going to make. Urgh. That's a clear signal you picked it up wrong. And I'll show you why in just a moment. There are many other causes of back injuries. And some of these, obviously, they contribute to other sprains and strains as well. Common causes, anytime you find yourself doing one of these things, you should think, danger, my back is at risk, because it really is. Now, the difficult thing about creating a back injury is once you have one, you have to really, really be careful for the time being, because you can re-injure that back really easy. Obviously, there are a lot of exercises and things that you can do to strengthen that back, as long as you don't overdo it, because sometimes doing that, you can actually re-aggravate something that you started. So anyway, trying to lift heavy objects, especially repetitive lifting over a long period of time, is one of the common causes. Another common cause is twisting at the waist while you're lifting. Remember those shoveling technique that we use? We go from side to side. We rarely ever move our feet. Just doesn't seem practical to get a shovel load of sand, move your feet, dump it, move your feet back. That's just not the way we were taught, is it? Twisting at the waist, holding heavy loads. This happens a lot when you're shoveling, just like we had mentioned a moment ago. Also, common causes is reaching and lifting over your head across the table or out of the back of a truck or something like that. Sometimes off a shelf. You know, I think one of the worst things that can happen is for you to take a box off the shelf. Maybe you didn't really test the weight of it, but about the time you get it off the shelf, you realize it's heavier than you're capable of handling, and now you're in real trouble because it's going to come crashing down, or you're going to hurt yourself trying to hold it up there, either shoulder spring, rotator cuff, something along that line. So those are things you really want to prevent. A couple of things we have to learn, and that is, it is okay to ask for help. It's okay. The macho man thing or the macho lady thing, forget it. If you can prevent an injury just by saying, hey, can you help me move this? It's as simple as that sometimes. And we have to keep that in mind. Common causes also is carrying awkward objects, odd shapes. My biggest problem is carrying a cardboard box because my hands stay so dry. And if I get a large cardboard box, not that it's that heavy, but maybe it's kind of awkward, but my hands are constantly sliding on it, and I'm trying to readjust, trying to re-grip, and I find myself doing a balancing act sometimes. So odd shapes and things like that. Also, working in uncomfortable positions. Sometimes you can be bending down, or maybe you're kneeling down working on something, or if you're under a vehicle or something and you're working on something, you get in a crazy position and you know that muscle starts to burn and it starts to let you know you're in that position, and this muscle is starting to let you know that you probably need to get up and stretch it out or something along that line. Also, standing or sitting for a long period of time. Sitting can be very hard on the lower back. We see this a lot with truck drivers. And if you'll notice, a lot of times when a truck driver pulls into a rest area or maybe a truck stop or something, and they step out of the truck, if you'll watch them, you'll see them out there. And they're constantly stretching their back out because they've been sitting for a long period of time, and that's the relief that they get, or they try to stretch that back out so it'll feel better and they'll be a little more comfortable. And we talk about that a lot of times. There's another example I want to talk to you about is whenever you see athletes run out on the field or out on the diamond or on the court or wherever they may be, what's the first thing you see them do? Well, they go out there and they warm up. They're not showing off. They're warming up. They're warming up their muscles. They're trying to get limbered up and loosened up because they're trying to prevent injuries is what they're trying to do. And there's nothing wrong with us doing the same thing, especially if we're going into something that we know is going to be some heavy lifting or maybe even some heavy activity, and maybe we're cold or we've been sitting for a long period of time. There's nothing wrong with loosening up those muscles a little bit to try to prevent some kind of sprain or strain, because that's exactly what the athletes do. Also, I missed this one. He said also, if possible, injuries can injure your back by slipping or falling. You may run into some ice somewhere, and I don't know how many times I've seen people back when I was dealing with a lot of workers' comp. Maybe they were going up a set of steps or coming down a set of stairs, and it was icy. They slipped, they grabbed the rail to try to hold themselves and tear a rotator cuff. Or a driver coming out of a truck, and he slips off the step and grabs the grab rail to prevent him from falling. And when all that weight hits the shoulder right here, there you go, you have another rotator cuff. Now, from what I understand about rotator cuff injuries, if you have to have the surgery is one thing, but the rehab is something else. The rehab can be quite painful for those, but it's necessary. You have to get your range of motion back in place. Now, when we talk about prevention, there are several things we can do, and I tell you, most of these are common sense, is to make sure that we're aware of these things and that we implement them whenever we have a lifting task that's in front of us. Avoid lifting and bending whenever you can. If you can get things up off the floor, up off the shelves, to keep it off the floor so you're not bending down. Maybe you can pick up from waist high or something like that. That's always a great idea. If you can use dollies or carts, that's not always available, but if you can, that's a way. Obviously, our best bet would be to use cranes, lift tables, and other lift assistance devices, forklifts, something along that line when you can, but again, that's not always available. Test the weight of an object before lifting by picking up one corner. That is very, very smart advice. It doesn't matter if it's over your head or if it's at your waist or if you're at the floor. Lift one corner of whatever it is you're trying to lift or you need to lift to try to get a feel of how much this thing weighs to make sure it's within my lifting capability, because it might not be. And if it's too heavy to lift alone, what do? You ask for help. There's nothing wrong with asking for help. Use proper lifting procedures. Follow these steps. Take a balanced stance. Your feet should be shoulder width apart. Your feet should be about as far apart as your shoulders are. Squat down and lift, get as close as you can to whatever you're lifting, and bend at the knees, not at the back. Bend down with the knees, get as close as you can. Pull that load in as close to you as you possibly can. Get a secure grip. Hug the load if you can. Lift gradually using your legs. Remember, your legs are the strongest part of your body. Right here. Right here, these thigh muscles are the strongest part of your bodies. Lift gradually using legs. Keep the load close to you. Keep your back straight and your neck straight. Now practice that a couple times, because I'm telling you, it's just not normal for us. A lot of people are very good at this. Some people are really bad at this. But remember, keep your back and your neck straight. Bend at the knees and lift with your legs. And when you get ready to set it down, once you're standing and you want to change directions with whatever it is you're carrying, move your feet. Don't twist at the waist. Remember that full curum? As long as it's in the middle, you can balance it. But if you move it to one end, then you have to take a lot more weight to lift. So if you get it out here, your full curum your balance is out. So you want to make sure you keep it balanced. Move your feet, set it down where it needs to go. Put the load down using these same guidelines in reverse. So it makes it pretty easy for you. There are a number of ways that you can help your back. Minimize problems with your back by exercise. Tone the muscles, backs, hips, thighs. Just like anybody else, always check with your physician before you take on some kind of strenuous exercise. You want to make sure you do that in case there's some medication you're on, or maybe there's something you shouldn't do. You need to know that. Exercise regularly every other day. Warm up slowly. A brisk walk is a good way to warm up. You see those athletes, when they hit the field, the diamond or the court or wherever they might be, you see them running, you see them jogging, you see them moving. They're trying to make sure they get good and warm so that they're ready for the job that they have to do. Inhale deeply before each repetition of the exercise, and inhale when performing each repetition. So you want to breathe in and out a lot. Keep that oxygen inside your body and keep it going. Take care of your back and it'll take care of you. But here's something you got to remember. If you can, exercise daily. Make sure you check on that first. Avoid heavy lifting. Get help with heavy and bulky loads. And if you must bend over, do it properly. Avoid twisting at the waist when carrying objects, and always watch where you're going. You'd think you wouldn't have to tell anybody that. Watch where you're going, but if you've ever seen the video of someone walking through a mall and they're texting and they walk right into the water fountain, it is one of the funniest things I've seen. But in today's environment and all the crazy things that's going on in the world today, you see some of these things. You see, I see people on forklifts sometimes driving through a warehouse, texting, not watching anything about where they're going. So always be aware of your surroundings. Make sure you know what's going on. And if you're in a situation where something happens, make sure you have an out. Make sure you know how to get out, okay? That's really, really important. So hope that helps you a little bit. We want to prevent accidents and injuries, sprains and strains by using proper lifting, whatever proper lifting techniques that we can use to alleviate the strains and sprains and the injuries on our muscles, our back, our neck, our shoulders is always a good idea. Okay? Thank you. Hope you have a great day, and I'll talk to you soon.